Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Paxlovid, a COVID-19 drug, may interact with common heart medications. A review paper published in the Journal of the American College of Cardiology examines the potential drug-drug interaction or DDIs between Paxlovid and commonly used cardiovascular medications, as well as potential options to mitigate severe adverse effects. Paxlovid received emergency use authorization from the US FDA in December 2021 as an oral antiviral agent for the treatment of symptomatic, non-hospitalized adults with mild to moderate COVID-19 infection who are at high risk for progression to severe disease. Now, patients with heart disease and other risk factors, including diabetes, high BP, chronic kidney disease, and smoking, make up a large portion of the high-risk population for whom Paxlovid is beneficial. Mediterranean diet, as opposed to popular belief, does not decrease dementia risk. A number of studies have suggested that eating a healthy diet may reduce a person's risk of dementia, but a new study has found that two diets, including the Mediterranean diet, are not linked to a reduced risk of dementia. The study is published in the online issue of Neurology Journal. The Mediterranean diet includes a high intake of vegetables, legumes, fruits, fish, and healthy fats such as olive oil, and a low intake of dairy products, meats, and saturated fatty acids. Hot flashes could also be hard on the heart. It's estimated that upward of 70% of women experience hot flashes sometime during the menopause transition. Although it has long been accepted that hot flashes can affect mental health and quality of life, accumulating research suggests a link between them and cardiovascular disease risk in women. Cardiovascular disease is the leading cause of death in women, with the risk accelerating in midlife during the menopause transition. Large epidemiologic cohort studies as well as clinical studies using physiologic assessments of vasomotor symptoms have produced evidence linking hot flashes and risk of heart disease. Lethal cardiac arrhythmias may be triggered in susceptible children by electronic gaming. Electronic gaming can precipitate life-threatening cardiac arrhythmias in susceptible children whose predisposition may have been previously unrecognized, according to a new report in Heart Rhythm Journal. The investigators performed a systematic review of literature and initiated a multi-site international outreach effort to identify cases of children with sudden loss of consciousness while playing video games. Across the 22 cases they found, multiplayer war gaming was the most frequent trigger. Some children died following a cardiac arrest. Subsequent diagnosis of several heart rhythm conditions put the children at continuing risk. CPVT and congenital long QT syndrome or LQTS type 1 and type 2 were the most common underlying causes. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.